I think it is a great opportunity for member countries because it is not every now that and then that we see that tuberculosis as a issue has been taken up at the UN General Assembly. In fact, this year is very unique because in the UN General Assembly we have three health-related high-level meetings: one related to pandemic prevention, preparedness, and response. Other one is on universal health coverage, and third one is on tuberculosis. And to me, it is an opportunity because in one way or the other, they are linked. Like because in the COVID-19 times, we needed to really keep the focus on tuberculosis and let the tuberculosis coverages not be slipped. But despite all efforts, it had a very huge impact on tuberculosis coverages of the detection, treatment, and prevention, and all the services. In relation to the tuberculosis, I do hope that the political declaration that is being considered by the member countries as an outcome of the UN high-level meeting not only brings together the actions, the science-based, practical, actionable suggestions to the member countries themselves also commit with increased domestic funding. They also should look into embracing science-based solutions recommended by WHO, be it related to prevention, be it related to detection, be it related to the newer regimes, and invest in human resource development, in the capacity development, and addressing the stigma as well. And this is where I'm looking at that the political declaration would also bring the players, the donors, the development partners together for a concerted, cohesive, approaches and funding mechanisms which are not overburdening to member countries. And as we go forward, I do hope that the high-level meeting on the TB also provide us opportunity for cross-learning, as you also mentioned in the early time in our discussion, that one country can learn from the other one. So whether it is South-South collaboration and South-South cooperation that we are looking into, or with the situation that the TB is still a problem in the countries of the European region, or the trends are different and they are going differently in other regions as well, probably Southeast Asia region could actually offer a lot of solutions. And such forums actually gives us an opportunity to bring that issue at the level of the head of the state or the head of the government. And some of the governments from the region have really played such wonderful leadership examples in the tuberculosis field. I hope that in New York, it would be possible for the member countries to be together, the development partner, the civil society, the voices of the community, the voices of the people, which have all been heard, all have been taken, and they would be there engaged in this particular discussion and dialogue. And we look forward to that. There is a comprehensive multi-sectoral response in action at the country level, at the subnational level, and in fact, only thing which I would say, at the level of an individual who may have been affected with the tuberculosis, that we have a responsibility to bring the detection, treatment, and all support services to that individual, and look into that how soon can we bring him back to the normal health that he or she is entitled to.